Hello, my name is Vibhuchita Jallu. I'm a current third year internal medicine at the Cleveland Clinic in Cleveland, Ohio. The name of my presentation is The Biliary Interventions in Patients with Sterile Pancreatic and Peripancreatic Necrosis Increase the Risk for Infected Collection. Background. Acute pancreatitis may get complicated by pancreatic and/or peripancreatic necrotic collections, PPNs, which when infected impacts mortality. It is unclear if antecedent biliary interventions, BI, like ERCP and/or PHTC, performed for biliary obstruction pose risk of infecting evolving sterile necrotic collections. The aim, to determine if biliary interventions increase the risk of infection in peripancreatic necrotic collections patients at two large volume tertiary care referral centers. The methods. All patients with necrotizing pancreatitis managed between 2009 and 2019 in two academic centers were identified from a prospectively maintained registry. Same admission cholecystectomy patients were excluded. Patients with a sterile necrosis who underwent biliary interventions for biliary obstruction without cholangitis were compared with controls who did not undergo any biliary interventions. Multivariable logistic regression models were constructed. Some of the variables that we looked at included gender, smoking status, etiology of pancreatitis, including alcohol, gallstones, post-ERCP, idiopathic hypertriglyceridemia, in addition to a history of cirrhosis and location of pancreatic and peripancreatic necrosis. Outcomes that we looked at included infected collection, ICU admission, in-hospital death, intervention, and reintervention. Other factors that we also looked at included patient age at admission, BMI, PFC size on the CT scan, length of stay, antibiotic days of use. Lastly, we also looked at the severity of pancreatitis in addition to the etiology of pancreatitis. In conclusion, we looked at biliary interventions in patients with sterile PPN increase the risk of infecting necrotic collections, leading to higher rates of collection, intervention, and reintervention. Biliary interventions should be avoided for asymptomatic biliary obstruction in patients with evolving pancreatic and peripancreatic necrosis. Thank you so much for your time.